fact, today you can go to any constituency and you will find dispensaries and health centers. Why our members cannot go to these places is that for a long time they were not accredited by the fund. But this time they will be, and based on the contributions which will be paid, we believe that drugs will be available to our members and they will be able to access care at the nearest point to them. Talking about private insurance, let me say that it is so expensive that even myself, there are many times I find it hard to pay for private insurance. I pay up to 40,000 for a cover. How many Kenyans can afford this? But what NHIF is proposing is something that is affordable, that will be able to cover the contributor with the whole family, so that the cover is household-based as opposed to private insurance, which is one-person-based. And
when you clarify household-based, how many?
Household-based, we mean that the man, the woman, and 4 to 5 children in that house are covered in the same contribution that we are asking for. It is the cheapest that you can get anywhere in the world. But if we say that people should go for private insurance, one person to pay 40,000, how many Kenyans can afford that? And so we are saying that the government should continue to build infrastructure, to improve systems for drug supply, and our members will choose where they want to get this care. And if they walk to a facility and the drugs are not available, they have a choice. We need to promote choice, and we promote competition between public, private, and mission hospitals. And this way, quality of care will improve.
We're talking, though, about, briefly, as we wind up this segment, you're talking about the benefits that will be accrued from the proposed new contributions. But there are there's quite a bit of opposition from stakeholders. Why do you think that is?
Well, there are many reasons why stakeholders could oppose, and this is my guess, is that there is a feeling that probably will be taking them out of business. But I want to assure you that the way this proposal has been made, even private insurance, even today, if you go to Aga Khan Hospital, you will find that the first charge, if you are a member of NHIF, comes from NHIF. And we want to assure them that all the players will have room to benefit from this proposal, including even the Hospital of Diana, and including all the mission hospitals and public hospitals. We want to say that private providers, public providers, mission will participate, and it will contribute to giving better care to our members who are outside, scattered all over the country.
All right, Diana, we're going to wind up in a minute, but give us your winding comment.
I think if the NHIF were able to deliver what it claims it's going to deliver, then I, as a private healthcare provider, would be very happy. We take a beating on people who come to utilize our services and then can't pay. So if somebody were going to pick up that bill, we'd be very happy, indeed. My problem with the NHIF and with the increased contributions, and don't forget, somebody earning 6,000 shillings per month who's barely able to make ends meet and feed his family now has to pay 300 shillings. He will go to a government hospital with his NHIF card where he may or may not get service. He can currently go there for, what, 10, 20 shillings, and he may or may not get the service or the drugs. He will be in the same position, but his family will miss meals. The minister makes light of 2,000 bob for very rich people making 800,000 a month, but that's not the issue here. The guy who's making 6,000 shillings who pays 300, the guy making 20,000 shillings who's paying 750 a month. And if that money is going down the tubes, they're not willing to pay.
Yes, we can assure the public that this time the money that they will pay will provide the care. And we are asking Diana to trust us with this money. And given the new constitutional dispensation, we cannot afford to make the same mistakes which took place. But given the scenario we have, Kenyans need care. And Kenya needs quality care, and they need it nearest to them where they are. And this is what the fund, which is a state corporation, is proposing to do, and we are asking that they should support it. It will help and it will make a difference. And we are open to scrutiny. In fact, I'm happy that Diana can raise this criticism because it helps us to be more careful. We welcome this because we are a public institution. We should be criticized, and we open it. We like it. It will help us to emerge a more stronger organization than before that can serve Kenyans with the package of outpatient care.
All right, Professor Muga, thank you very much. We're going to wind up for the moment. Professor Muga, the chairman of the National Hospital Insurance Fund, thank you for joining us tonight.
Thank you.
Diana Patel, the executive director of Avenue Healthcare, thank you for being on the program. And we'll take you up on the guarantees, Diana, that he has given us on this program now. I'll take you back to our City Center studios where Njoroge and the rest of the team will take you through the rest of the day's news, including the business and the sport. From here, bye-bye.